So you're ready to take your skincare up a level with in-office laser treatments, but with so many out there, where do you even start? I'm gonna break it down for you. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. I've actually been getting this request for a couple of years to make a YouTube video that really breaks down lasers for you and which ones you should get for which concern you have, so finally I am doing it. Not every dermatologist has access to lasers when they are going through their dermatology residency and their training, and I feel very fortunate to have gotten to train with some of the best laser surgeons in the US. And now laser treatments make up a large part of my cosmetic practice, so I'm happy to be able to guide you in choosing the right lasers for you depending on what your skin concerns are. Now, I could talk for hours about the physics of lasers. It's incredibly cool. They are fascinating devices, and the way that they work is absolutely amazing. But really what I'm going to do today is talk to you how I would talk to my patients. When someone is coming into my office with specific cosmetic concerns, what laser recommendations am I going to give them to address that? And I'm not just going to be talking about what lasers you could potentially do to address your concerns, but also what downtime can you expect? How much does this generally cost? All the stuff you really need to know. I don't want to get too sciencey on you here, but I think one concept that is important to understand when you're thinking about laser treatments is they work through a process called selective photothermolysis. And basically what that means is each individual laser is going to target one thing very selectively in the skin, whether that's water or hemoglobin and blood vessels or pigment like melanin. And the reason that's so important to understand is because I think a lot of people come into a dermatology office expecting to get one laser treatment that's going to address all of their skin concerns. But lasers are extremely precise and focused, and that's why we love them, because we can have the accuracy and the precision that we need to deliver excellent, safe treatments. But it also means that lasers are going to do one thing very, very well, like target pigment or refine fine lines or get rid of redness. It's very rare that a laser can do all of those things. And so often, because of that, for my patients in my office who have multiple types of aging skin concerns, we are doing multiple different laser treatments to get them the holistic outcome that they're seeking. That's also why I think if you are considering having laser procedures done, it can be beneficial to go to an office that carries a wide variety of lasers. If you go somewhere that only has one laser, they're going to try to make that laser fit for all of your concerns. And I guess that's not fair, like that's speaking very generally, but I've seen that happen many times to patients. Let's start off with talking about pigmentation, whether that's melasma or freckles or sunspots that have developed over your life. And I actually want to start off talking about melasma because if you came to this video to try and figure out what laser treatment is going to cure your melasma, none of them will. In fact, there is no laser, chemical peel, or any other type of in-office treatment that will permanently get rid of melasma pigmentation. And the reason I say that is because I get patients into my office every single week who are coming in saying, listen, I've had melasma for 15, 20 years. I do topical things for it. It makes it go away, but it always comes back. And now I'm ready to do a laser treatment to permanently get rid of it. And then I have to be the one who breaks the news to this patient that unfortunately there are no laser treatments that get rid of it permanently. In fact, no laser treatment has been shown to provide better results than what topical treatments do. And that's why if I have a patient who has melasma who comes in wanting laser procedures, we shift the conversation to topical skincare and medical interventions because that is a lot more affordable and can give you equal or better results. And no matter which way you're intervening, medical or cosmetic, ultimately melasma can always come back if you're not keeping up with those treatments. And I do have patients who say, listen, I can't use topicals for X, Y, or Z reason, or I don't want to, I want to do laser treatments. That is completely fine. We can improve your melasma temporarily with lasers, but you need to understand that the pigmentation will always want to come back, and it will come back. And if you're willing to make that investment, that's okay, but you need to understand that. But now let's talk about types of pigment that actually respond super well to laser interventions. These brown spots are essentially an accumulation of sun damage over a lifetime. In the clinic, they're usually categorized as something called solar lentigines or macular seborrheic keratoses, but a lot of patients just call them sunspots or liver spots. And there's sort of two ways these can be targeted in a laser setting. You have lasers that specifically target melanin or pigment in the skin, and so those are really good at going after very distinct spots. And then you have lasers that target water in the skin that are being performed over the entire surface of the skin and sort of clearing out out brown spots in their path. So first, let's talk about the ones that target pigment directly. Probably the most common ones that I come across in practice are Q-switched Alex lasers and Picosecond lasers. And if we're talking brand names here, this is going to vary kind of where you are in the world. Probably the most common Alexandrite laser that's used to treat pigment is called an Alex TriVantage. And then when it comes to picosecond lasers, you're looking at like the PicoWay and the PicoSure laser. When I describe these types of lasers to patients, I describe them as snipers. They're going after very distinct brown spots, and that's their only target. In my office, we used to have an Alex TriVantage, now we have a PicoWay laser, but essentially what we're doing is targeting those specific spots. When we hit them with the laser, they turn white very temporarily, and then they turn into a little scabby spot that heals over the course of a week. And most spots will actually go away with just a single treatment, though I usually like to see my patients back about a month and a half later to clean up anything else that's left over. This is my go-to laser if I have a patient who has very distinct brown spots, but if someone has a lot of sort of faint brown or irregular pigment, I'm going to pick something else. The Q-switched Alex laser and picosecond lasers tend to be very well tolerated by patients. However, anytime you are targeting pigment in the skin, the main risk that is involved in that laser is causing hyperpigmentation or hypopigmentation. And the deeper your skin type is, the more likely you are to experience that. And that's why if I have a patient who has like olive skin or anything darker than that, I'm usually going to do a test spot on 1 or 2 of their spots, see them back in 6 weeks, see how their skin respond, and then decide from there if doing additional treatments is worthwhile. This can be a little bit annoying to patients because by the time they're in the office getting the treatment, they're like, just like get my spots. But it's so important that we are prioritizing patient safety and ideal aesthetic outcomes over everything else, even if it takes a couple of test spots and a couple more months to ensure that we are going to get the outcome that we're seeking. I think something that's maybe worth noting is that picosecond lasers tend to be considered a bit safer when it comes to protecting the pigmentation in patients who have a deeper skin tone. The reason for this is picosecond lasers work over the course of trillionths of a second. They deliver energy so fast that other surrounding tissues are less harmed. Of note, picosecond lasers are also really great at tattoo removal because they can go in and bust up that pigment and then get out of there quickly. Now, if you have more than just a few brown spots on your skin and you have more diffuse pigmentation or freckling or just like diffuse photo damage is what we call it, then we're looking more at lasers that target water in the skin and are going to pass over the entire surface. So those are things like fractionated non-ablative lasers and fractionated ablative lasers. These types of lasers create columns of heat if they're a non-ablative laser, or columns of vaporized tissue if they're an ablative laser within the skin. And then your skin kind of heals around those columns of destruction. These types of lasers can also be really good for treating fine lines and wrinkles, which I'll get to in a second, but they can be helpful for pigment because you're essentially busting up the entire skin surface. The beauty and the importance of them being fractionated is that they are not taking away the entire surface of the skin. They have little columns that they are treating, and so you have healthy skin in between, which means less downtime, faster results, and faster healing. Probably the most popular fractionated non-ablative laser is something called Fraxel Dual. It's what we have in my office. There's also the little sister to Fraxel Dual called Clear and Brilliant, and that's for like baby amounts of pigment, tiny amounts of texture, whereas like the full Fraxel Dual is for more texture and more pigment. And then fractionated ablative lasers are things like a CO2 laser or an erbium laser. And there are also laser treatments that sort of combine those two things. So for example, the Halo laser has an ablative component and a non-ablative component. Fraxel Dual is incredibly popular in our office. The dual in the name stands for the 2 different wavelengths it has. It has a more superficial penetrating wavelength and then a deeper penetrating wavelength. And the one that's more superficial is really the one that's targeting the pigment in the skin. When you have a Fraxel treatment, you're usually getting topically numbed for about an hour up to an hour and a half because like lasers can be pretty uncomfortable and you want to make the patient comfortable. The last thing I want to do is have to turn down my laser treatment because the patient can't tolerate it. And then with a Fraxel, you are essentially rolling it over the surface of someone's skin somewhere between 4 and 8 times to get the coverage that you need. After that, the patient is going to be bright red and a little bit swollen for a couple of days, and then they're going to have somewhere between 2 and 7 days of light flaking and peeling everywhere. And that flaking and peeling is those little columns of heated skin waking their way to the surface and exfoliating off. And it's actually pretty common for me to combine a PicoWay treatment and a Fraxel treatment in the same day. I will first do the PicoWay treatment where we are targeting all of the little specific, very dark brown marks. And then afterward, I will do a Fraxel treatment. This is nice because it kind of takes all their downtime and puts it into 1 week, and they're going to get a much more impactful result that way too. And although patients can have a beautiful result with just 1 treatment, most of my patients are doing 2 or 3 of these treatments because they are trying to correct protect a lifetime of accumulated sun damage. A CO2 resurfacing procedure, so an ablative fractionated laser, can do exactly what a Fraxel does, but it can do it more intensely. But you can also really turn down a CO2 laser and make it like a baby treatment. CO2 lasers generally are more expensive, the downtime is a little bit more intense, and I think that's why a lot of people end up opting for a fractionated non-ablative treatment like Fraxel Dual. I do want to speak a little bit to cost because I do think that informs how people choose maybe what laser they're having done. If you're having like a PicoWay or a Q-switched Alex treatment to treat specific brown spots, what that charge is going to be is usually based on how many spots you have or how long they think the provider is going to need to treat you. That can usually range from like $200 to like $1,200 a session. Then when it comes to a Fraxel laser, again, this is going to vary so much by who's treating you, where in the country you are, but I would say a single full face Fraxel is probably somewhere between $1,000 and $1,500. And then it will be more if you're adding in your neck and your chest, which a lot of people do. And then when you're looking at a CO2 laser, again, this is going to depend on how intense the settings are, how much sort of downtime and hand holding the provider thinks they're going to have to do for you. But a CO2 laser of your entire face can be like $5,000 and above. Though I do have a friend in Louisiana who says it's only $2,500 there. So again, it really depends where you are in the country. So that sort of sums up addressing pigment in the skin. I do want to make a note about a different type of device that is technically not a laser, but is very popular in cosmetic offices for treating brown spots, and that is IPL or BBL. IPL and BBL are essentially the same technology. One stands for intense pulse light, the other stands for broadband light, but these are not lasers because they are using multiple different wavelengths of light rather than a laser which just uses one wavelength of light, but you know, semantics. The point is that these light-based devices, IPL and BBL, are also very good at targeting brown spots in the skin. The benefit of them is that there's really no peeling or flaking afterwards, so the downtime can be a bit less, but you still require a series of treatments and you still have to numb for those treatments. IPL and BBL treatments tend to also cost a bit less, so usually they're ranging somewhere from maybe $400 to $700 a treatment. So if I have a patient who comes into my office and they have relatively youthful skin, not a lot of wrinkles, a good amount of radiance, but just lots of brown spots, that's where IPL is going to be the most helpful. Now, that's not to say that someone who is extremely photo damaged isn't going to benefit from IPL. They completely would, but oftentimes they will opt to do a Fraxel, so something a bit more intense, because Fraxel also offers some resurfacing capabilities, which I'll get to in a second, where you're not just taking out the brown spots, but you are also able to improve the texture and the tone of the skin. And like I mentioned before, I will often combine a PicoWay with a Fraxel, so you're getting kind of that sniper action on the really dark brown spots, and then a more diffuse background treatment with the Fraxel to pick up everything else. So that's kind of a wrap on pigment. Please let me know if you have tried any of these lasers and what your results were. Let us know in the comments. People love reading the comments and learning from you guys in this community, so please share your experiences if you feel comfortable. Thank you so much for being here. Don't forget to give this video a thumbs up and make sure you're subscribed to the channel, and I'll see you next time.